Countries in the Americas face challenges with unequal access to health, to education, to social services, and they are also dealing with demographic shifts, including an aging population that needs long-term social policies and healthcare. Today, it's my pleasure to speak here today with Dr. Jarbas Barbosa of the Pan American Health Organization about global health, about the opportunities to build global health resilience, Brazil's G20 presidency as an opportunity to position the region's priorities, and plans for the organization's role in enhancing health across Latin America and the Caribbean. Thank you so much, Jarbas, for being here with us.
Oh, thank you for inviting me to be here.
It's a great pleasure. Well, Dr. Barbosa, this was the first time ever that COP in Dubai had Health Day. And we saw also that 40 million health professionals signed a call to action promoted by the World Health Organization asking to include health in the climate change negotiations. I want to ask you, how do you see that this moment when the world is finally seeing health as cross sectors, not only as a sector itself, as an economic sector, but as an issue that has an impact in different areas of society? And what are the opportunities to use that moment to also interact in different forms with the private sector and the nonprofit sector?
No, it was very important to have health during the COP meeting. Our team was there because it's clear that you have a direct and indirect links from the environmental and the climate change with health. Not only the acute deaths related to a heat wave, for instance, but also the vector-borne diseases that are very importantly affected by climate change. We also have food insecurity, also due to climate change, that has a very important impact on health. So we are working with the countries in the Americas, in Latin America and the Caribbean, how we can have the health facilities more resilient to extreme weather events, how we can support them to measure the burden of the impact of climate change on the health sector. So I think that this is a very important topic that we expect that in next COP that will be in Belém, Brazil, in the Amazon region, that for instance is the region in the Americas that we have the most impact of malaria that is affected by climate change. So I think that this will be a very good opportunity to keep on the conversation about how we can have these two important issues working together to reduce the impact on vulnerable populations.
Excellent. Well, we all saw that Latin America and the Caribbean were heavily impacted by COVID-19, and we recovered thanks to vaccination, obviously, and thanks also to the recognition of the importance of public health and multi-sector engagement. What were the main lessons for the region after COVID?
The first lesson is that we need to be better prepared. I think that nobody was prepared to a pandemic with the characteristics of COVID-19. Because when we thought about the preparation for pandemics, we thought about SARS in 2003, we thought about MERS in 2011, that were both related to a cousin of the COVID-19 virus because they were also coronavirus. And these were diseases that many severe cases were produced, but the disease spread slowly, so we had time to control. Or we thought about the pandemic related to the flu virus, like the 2009. That spread very fast, but didn't produce a number of severe cases that would put a challenge to the health services. With COVID-19, we have both situations happening at the same time. A disease that spread very, very fast and that produces so many severe cases that even the hospitals and centers in the most developed countries, like in Italy or in New York, they were totally unable to respond. So this was I think that important lesson. We need to be prepared, better prepared. We need, and to be better prepared, I'm talking about to strengthen national capacity in each country for early detection and response. But also we are talking about how we can increase and improve global governance. And we will have in May, during the World Health Assembly, a very good opportunity to establish a new treaty, a new agreement that will provide better preparation for the countries, including addressing the lack of equitable access to vaccines and medicines and PPEs that was a real and dramatic problem for Latin America at the beginning of the pandemic.
Absolutely. And talking about equity and also the priorities for the region, I want to ask you, and first of all, tell you, well, the Brazil Institute is this year leading an initiative called the Wilson Center G20 Dialogues, which will focus and understand and interpret Brazil's leadership of the G20. And obviously, health has a working group within the G20 and is going to bring a number of proposals and discussions to the table. How do you see that the Brazil's presidency of this group can foster, can make that the priorities for the region are better prioritized in the global stage?
This will be a very important opportunity. We know that the G20 is not only about the health, but the health needs to be part of the dialogue about the development. So I think that is important. Brazil and the President Lula has already established some priorities that are very well related with the health sector, the hunger, the inequalities, the social development. So I think that this will be a very good opportunity. We are working with the Ministry of Health, providing support to them, because we will have not only the discussion about the traditional discussions that the G20 has held on the health issues in the last years about the AMR, antimicrobial resistance, and about the pandemic in recent years, but also to see how this relationship between poverty and health can be addressed. The most vulnerable groups, they are most vulnerable also to get a communicable disease or non-communicable disease, and when they get ill, they increase their poverty because they will have many important losses. They don't have income during the period that they are sick. They will have to be transported to a health center. In some countries, they will need to purchase their medicines. So there is this kind of a vicious circle between poverty and health. So it's important that when G20 is addressing this to recognize that health can play a very important role to reduce the poverty and to provide a more equitable and sustainable development.
Perfect. And well, you mentioned the burden of certain diseases and also how inequality puts this burden in certain sections of the population. And we all know that it's given the global rise of cancer diagnosis, and it's expected to increase. How do you see that those countries, the developing world, the Americas, can get together, maybe the G20, maybe in other multilateral forums, to look into the transition to biosimilar drugs, to guarantee not only the accessibility, but also the access to innovation on those treatments?
This is really very important because we have new medicines that are for many different cancers. The antibody-specific medicines, the monoclonal antibody medicines that for many types of cancer, they can change the game. They can provide better conditions to people with these cancers. One problem is how to have access to these medicines, because in general they are very costly. But at the same time, you have now the biosimilars that are being produced in many countries in Latin America. And it's important to have this dialogue as part of a broader dialogue about how to guarantee access to new technologies. When we are thinking about how to strengthen with the support from the governments and building a strong alliance between the public and the private sector to develop new technologies, we also need to think about how to make them affordable to everyone.
In talking about new technologies, I want to talk about the technology of the last year and probably of this year, which is AI and the use of AI in preventive medicine. We see, for example, it's being used to prevent breast cancer, for example. And how do you see that spreading in the region? Do we need more investment? Is the sector, the private sector, the public sector ready to implement and adopt at scale this new technology in the health sector, especially when it comes to prevention?
I think that this is one recently development that we have had that we need, of course, we need to explore better. There are many centers in the world that are trying to use artificial intelligence to provide a better screening for different things, to identification of breast cancer and others. We have in the region, I went to Brazil last year and the Minister of Health presented a very good experience that collaborative center in Minas Gerais that probably has the biggest database of ECGs in the world. They have more than 150,000, and they started using artificial intelligence. It's a pilot project to use as a screen. So to identify first if it's a normal ECG, you don't need to go to a cardiologist, or if you need a second opinion. So this is the kind of thing that probably artificial intelligence will change. We will allow the doctors, the nurses to be focused more in the more complex cases, because for X-rays and the MRIs and other images, exams for instance, probably artificial intelligence will be able, maybe not this year, but in a couple of years, they will be able to identify what is a problem that needs to be further assessed, or what are the things that are normal and you don't need to go to a second or a third exam.
Still in this chapter of technology, and I know it's of great importance for PAHO to work on digital transformation and the access of telehealth throughout the Americas. And you have worked with, partnered with the multilateral banks, especially the Inter-American Development Bank, to foster that throughout the Americas. How it may unfold, tell me a little more about this partnership.
This is a partnership that started 5 years ago, 6 years ago, because last year we celebrated, I had the opportunity with the President Ilan Godfan from the IDB to celebrate 5 years of a good partnership that started to strengthen information system for health. But now we are moving to include also digital transformation. And with this partnership, we make an assessment, we perform an assessment, and almost every country have already applied this instrument, and we also identify what are the gaps, what are the challenges, and we develop a plan of action, how to strengthen the information system for health in the country, including now digital transformation. So the countries can use the loans that they already have with the IDB, or they can contract new loans to strengthen the information system and digital transformation for the health sector. With this partnership, the countries have mobilized more than $800 million in these 6 years, and we expect that this will increase a lot, because many countries now they realize that they need to improve the quality of the data, they need to improve the access for telemedicine. We had some pilot projects in countries to telemedicine, improving the quality of care in remote areas, for instance, allowing a primary health care team to have consultations with specialists when they need to do that, so we don't need to transport the patient. So this is, I think, that we have many important opportunities to use telemedicine, to use digital transformation as a tool to reduce barriers to access and to increase the opportunities that people have to get the better care that is possible.
Excellent. And talking about supply chains and considering how much the pandemic showed us the interdependence between global and local supply chains, how do you see that the national health systems can work with the health industry, the pharmaceutical industry, for example, to collaborate more effectively to ensure that to ensure a more stable supply of medicines, a more stable supply of essential medical inputs, if it comes another emergency situation as we lived, or just to guarantee a more resilience in those supply chains.
This was a very important vulnerability that the pandemic highlighted. You know that even personal protective equipment like gloves and masks, our countries in Latin America, they were struggling to get access to them at the beginning of the pandemic, because almost every PPEs for these regions, they are imported from countries in other regions. So we established a regional platform to strengthen the production in Latin America and the Caribbean. We are working with the government, but also with private sector to identify what are the opportunities that we have, what are the needs that we have. The experience that the countries had during the pandemic was so dramatic that every country wanted to produce vaccine. And we were telling them, okay, vaccine is very complex and very expensive to produce, but maybe you can start producing masks and gloves. And this will be important not only for your country, but for the whole region. So we established a hub to certify the quality of masks, gloves, and goggles, and other PPIs in El Salvador. So producers in Central America and the Caribbean have a quality certification closer to them and much less expensive. And in other countries, we are also trying to work with the government and the producers how we can strengthen generic production, biosimilar production in order to increase the access. We also have engaged in a global initiative to have mRNA vaccine production in the region. Two projects, one is a private one, Synergium in Argentina, the other one is a public, Fiocruz in Brazil. But the idea is that the vaccine produced there will serve all countries in the region through PAHO's regional pool mechanism, that is a revolving fund for vaccine. So the idea is to identify with the countries what are the opportunities that you have, what are the needs that you have, and to establish feasible and sustainable projects.
Yeah, indeed, there are many lessons that came out of the pandemic, obviously, but one of them, I think, is also about how much our governments need to deliver very concrete things and be very agile and adaptive. So looking ahead, what do you think that, especially looking at your mandate at PAHO, what do you think are the most important priorities for PAHO in the next years during your mandate?
You know that we have a so complex epidemiological scenario that it's hard to choose one, two, or three. But I think that to have more resilient health systems is one of them for sure. In more resilient systems, we are talking about renewed and strengthened primary health care. A primary health care that can deliver from mental health to elimination of communicable diseases, that can provide screening, diagnosis, and treatment for non-communicable diseases. I think that this is really very important because we will address two important problems that we have. Some communicable diseases that are still a problem in many countries in the region, and we already have the tools to eliminate them. So it's not acceptable to delay the elimination. And at the same time, to reduce the more than 1/3 of deaths related to non-communicable diseases in our region are preventable, could be prevented if they had been diagnosed earlier. So I think that this can change the game, this can reduce the barriers, this can guarantee more access and move it toward the universal health. That is our main goal for the region.
Universal health. Okay. Thank you so much, Dr. Jarbas. I really appreciate your presence here, and I always learn so much from your remarks. Thank you so much.
No, thank you.